opportunity for us to convey that cancer is not the same as it was 30 years back.
There is always a fear about the hormone therapy. Why is it so?
Fear is lingering because of the movies and other stories and images which we have in our minds. When this control is lost, it leads to cancer formation. Screen time is the new addiction, and that is causing a lot of problems, a lot of diseases, not just poor social networking, because people hardly talk, they only message it to each other and spend a lot of time and have thousands of friends, meaningless friends, and not one or two good friends. Tell them, भैया अपनी story अपने पास रखो. I know what I am doing and where I am, what I have to do. So if I have to use this opportunity to convey one message, it's all about early detection.
Welcome back to Expert Touch, the podcast where we simplify all the medical topics so that everybody can understand them very easily. Today, we are going to talk about a topic which is affecting millions of women globally: breast cancer. Do you know breast cancer is one of the most common cancer in women nowadays? But the good news is early detections can literally save their lives. So today, to break it all down in a very simple and a very easy way, we have Dr. Harit Chaturvedi with us, chairman of Max Institute of Cancer Care. With his 30 years of experience in cancer treatment, he is here to help us tell about more about this topic. Welcome, doctor.
Thank you. Thank you for having me.
So let's start with the topic. The first thing I just want to know, what causes breast cancer and why is it so important?
So, frankly, all cancers have few things overlapping. Okay, for example, we know that there's a triad which leads to cancer development, which includes your environmental factors, dietary factors, and internal factors also, like hormones in the body and genetic predisposition and things like that. So, in breast cancer, the important factor is the hormonal imbalance. And I should not use the word imbalance, but overexposure to estrogen. And that can happen for multiple reasons: early menarche, late menopause, even weight gain is a etiological factor for breast cancer. Alcohol intake, tobacco, that also contributes. So these things are the general things. Then delayed pregnancy, because there also the estrogen window is not interrupted by pregnancy. So that also has nulli parity. So these are the factors which play in the development of breast cancer. And typically, cancer is when an ordinary cell gets rogue. That means it starts multiplying in an uncontrolled manner. Normally, our body has a huge balance of where the growth of the cells is also happening, and the unhealthy cells are getting eliminated as well in the same time in a controlled manner. When this control is lost, it leads to cancer formation. So, for example, in oral cavity or breast or gut or anywhere else, anytime there are multiple cells multiplying. But this, what imbalance we talked about, the triad for cancer, the hormonal imbalance plays a crucial role, especially in breast cancer, and that leads to this imbalance in the control of the cells.
So do you really think early detections can save lives? Is it important if it's detected at the right moment?
So, if anything can save lives, it is early detection. First thing in our hands is prevention. So, as we discussed, that there are certain factors which we call modifiable, that we were talking about, that estrogen factors or nulliparity or weight gain or certain dietary patterns which are more heavy on fats and other things which lead to more estrogen. That is in our hands. Genetic predisposition is not in our hands. That is non-modifiable factors. Now, modifiable, for example, if you're exercising well, then your estrogen is relatively managed and under control. So if you have these eye on these modifiable factors, obviously there will be a prevention. But if you cannot prevent or something is destined to happen, so there are certain factors we don't know also. It's not that we understand everything. What we don't know, if we prevent or detect in early stage, the cure rate is much higher. The side effects of treatment are much less. And the morbidity or the suffering is even much less. So I always say this, if you pick up in stage 1, your probability of cure is 95% plus. Your cost of treatment will be probably 1/3 of what it is in a stage 3 probably. And the impact on body image, whether it is a loss of organ like breast or the effects of radiation, chemo, those things, whatever we talk of, everything will go down significantly. So if I have to use this opportunity to convey one message, It's all about early detection and prevention, obviously.
Totally agree. It is literally very important.
Very, very
After
important.
listening to your thoughts, I also feel it's literally very important.
Very important.
But like you feel women should be scared of it. If not early detections, if not stage 1, women should be scared of it.
So, see, scare does not invoke the right reaction. However, whenever the word C comes, whenever cancer word comes into play, scare is bound to happen initially because we all relate this in our minds as something which is very morbid, where the mortality is high, a lot of suffering is associated. The word itself invokes those things. So that is a situation which was true probably 30, 40 years back. 30, 40 years back, the survival for people who were diagnosed with cancer was only about 20-25% in our country. Today, this is hovering around 40-45%, the number of people who get cured of cancer. And if you look at the Western data, the cure rate is almost around 70%. And the reason for that are manifold. First is obviously in our scenario, there is an improvement in terms of early detection. It's not the same as it was 30 years back. Today, I would say relatively higher number of people are coming in stages 1 and 2 compared to 3 and 4. And that has also improved survivals. The methods of treatment have gone up. The opportunities and ways to treat have improved. The understanding of tumor leading to multimodal treatment application has significantly improved. So if I look at the play of all these things, understanding leading to early detection and tools available for detection, then the methods to treat the person effectively and cure, or even in recurrent situations, you can treat a significant number of people, that everything has added on. And therefore, today I would say of 100 people diagnosed with cancer, 45% would probably get cured of cancer or not die of cancer. So this is a huge jump compared to 20%. But I still know that we have to cover next 25-30%, and that will happen in our lifetime because of the available knowledge, the way things are exchanged and understood. So I'm pretty sure that we will see in our lifetime this fear of cancer completely gone away. But this is a very important question and a very important opportunity for us to convey that cancer is not the same as it was 30 years back. The fear is lingering because of the movies and other stories and images which we have in our minds. If we really research well, put our best effort, use all our resources in our hands, today a lot more people get cured of cancer.
True, very true. So, can you just elaborate more about stage 1 of cancer?
So typically whenever we talk about staging has 3-4 purposes. One is, it is like putting information in an order. So when we say stage 1, it means the tumor is organ confined. It is in the same organ. It has still not spread anywhere. And also within the organ, it is of small size. So for example, in breast case, in the situation of breast cancer, stage 1 means less than 2 centimeter size tumor. That is stage 1. Now today we understand there are multiple types of cancer. Therefore, if I say stage 1, even 2 centimeter size tumor with ER/PR strongly positive, HER2 negative, or what we call luminal A and luminal B type, that is qualifies for stage 1. And as the size grows, or the triple negative types or the HER2 positive types, they go into stages 2 and 3. So stage 1 for breast, for oral cancer, for colon cancer, or for any organ for that matter, generally implies small tumor limited to the organ and therefore simpler to treat and higher cure rates.
So, can you please just tell me about the key warning signs one should know?
So, in case of breast cancer, it is the common presentation is a breast lump. I also want to say that those people who go for regular screenings and checkups, there we pick up even non-palpable lesions. And there the cure rates are significantly higher. That is why we encourage women to have annual screening and health checks, because that picks up cancer before it gets felt. And this may be anything like up to a year, picking the cancer early by a year. And that you can imagine the impact on survival. That is huge. But as far as warning signals of breast cancer is concerned, lump is one of the most common. Nipple discharge, which is spontaneous, which happens on its own. Sometimes women check their breast and then squeezing they find little discharge. That is not very important. If it is spontaneous discharge, that is very important. Then the color discharge. If it is a bloody discharge or a watery discharge, that is important. And other things are vague symptoms. Sometimes pain, heaviness, skin discoloration, or skin thickening. So this is something which is very important, that women should be comfortable with their breasts. If you find anything unusual, anything which is not there earlier, please reach out to your doctor and do basic checks. So, when I say basic checks, what I mean is physical checkup by the doctor, and also always do imaging of some type. For women above 40, it should be at least a mammogram and an ultrasound. But for women less than 40, ultrasound is a must. One should not just rely on inspection or clinical checkup. That is a big fallacy. You will not pick up every time that lump which you had picked up earlier, or you have some discomfort. When second time somebody is seeing, it may be lost. Because in the breast tissue, the lump will not be felt stand out. A 1 centimeter lump in the breast will not stand out. And so one can miss. It is very important to do a thorough checkup and at least support by imaging. I also want to say in the same breath that whenever there are lumps in the breast, 9 out of 10 times, they are likely to be benign, not cancerous, not something which is dangerous. But remember, the important thing is that one cancer, which is the dangerous thing. So it is better to investigate those 10 times so that you pick up that one early, rather than assuming that it is benign, it is often not malignant. So why do biopsy? Why do testing? Why go further? No. Every time the lump or the symptom has to be fully worked up. That we call it the clinical triad. Clinical examination of findings, imaging like ultrasound or mammo or whatever, and then if there's anything, then do a biopsy or do a cytology. These three things are very important to make sure that we have a proper diagnosis.
Okay, but like how often should women get checked up?
So if there are symptoms, then you have to get checked up every time. Every time means if you have some symptom today, get it checked by a doctor tomorrow or within a week. And if it is not getting sorted, after maybe a couple of months, even if the doctor has assured you that everything looks all right, I will suggest that if the symptoms are not sorted, after a couple of months, recheck. So this is a very important point. The reason why there's delay of diagnosis, because the first round of workup may not be thorough and complete. And if we put a stamp that no, we have checked and this is all benign and everything is comfortable, and you ignore that for 1 year, then again there's a big probability something which was lingering, which was small, which was hidden, which could not be picked up in first go, has now grown and become significant. So every 2-3 months, if symptoms persist, one should get it reviewed and checked. If it is not symptomatic, person is fine, then we talk about annual screening. And annual screening applies for women above 50 years of age. Between 40 and 50, it's a gray area because the breasts are dense. Mammography is difficult to pick up a lesion, and also it's often difficult to palpate. So these areas are difficult, but beyond 50 annual, between 40 and 50, I talk about biannual checkup. Every 2 years, get it checked. So this is for screening. But for symptoms, don't wait for annual thing and anything.
It's very important.
And if somebody has history of breast cancer in the family, in that case, it is pertinent to start checking at least 10 years before the first degree relative who got breast cancer.
Okay. So can you just elaborate more about this topic? Like it transfers to the history, it transfers to the genes. Is it true?
So only about 5% of breast cancer have genetic predisposition. We know about this BRCA mutation and BRCA genes, BRCA1 and 2. So women who have this gene mutation, they have the possibility of getting breast cancer anything between 50 and 80%. So not that everybody is likely to get. No. In some sense, it may be only 50% population will get that risk. But the risk is high. So there are two ways to approach this. One is that go for regular screening. Every 6 months mammogram or MRI. Mammogram or MRI. For example, every June, do an MRI. Every January, do a mammogram. So you have a checkup and also doctor review. So one way is that. The other way is sometimes people opt for prophylactic surgery, getting the surgery done. But this is not mandatory. This is just that people have to understand and solve for themselves what they are comfortable with. If somebody is confident that I can do regular screening, then yes, the risk of dying is very, very low.
So can you just tell me about the radiation process? Like what is it? If somebody has cancer and it is not treated in the first go, what is the next step? Radiation?
So when we talk about treatment of breast cancer, there are three modalities which are often used: surgical, medical, radiation therapy. So surgical is the surgery, doing the surgery. That means removing the lump or removing the breast or doing a breast with reconstruction. All these three options. Then there's something called sentinel node biopsy, where we are sure that the axilla is clean and there is no significant node in the axilla. Then we do what is called a sampling of the node from the axilla. In that scenario, the possibility of uh, making sure that the axilla is actually sterile is almost like 97-98%. So that is sentinel node. But as far as the breast is concerned, majority of women today can save their breast by early detection, and also in cases where there's not so early, we can do what is called a neoadjuvant chemotherapy or systemic therapy and shrink the tumor and do a conservative procedure. So that is possible. And so surgery is that. Chemo is obviously the treatment by drugs, and there the chemotherapy agents or sometimes immuno is also used. For radiation, what you're saying is another form of local therapy like surgery, which is important for all patients who undergo conservation, where the breast is not removed, or those who had node positive disease, or who had large tumors in the breast. These three subsets must be treated by radiation alone. So this is a treatment of 2 to 3 weeks. Earlier it used to be 5 to 6 weeks. Now it is only 2 3 weeks treatment. The machines are fairly advanced. Today we are able to save the lung and the heart or remaining structures very well while treatment with radiation. So radiation is much safer than what it used to be 30 years back, and very effective to help in good local control. So the fear of radiation or fear of chemo should not be there. It is that the side effects are significantly less today.
Okay, okay.
The other modality which I would say is the hormone therapy, which is very important because in breast cancer, almost half the women can be treated only by hormone therapy, where chemo can be avoided. So how to select that group of patients whose tumors are hormone sensitive? So typically we do their ERPR testing, and then those who are in the favorable group, we have some precision marking testing where we get a score, recurrence score, and we know that in this subset we can avoid chemo completely, and they're treated only by hormone and surgery.
Okay. So, like radiation is before chemo, right?
No, whenever chemo has to happen, then radiation has to happen after chemo.
Okay, okay.
And so there are typically two patterns. One is those who go for direct surgery, they will do surgery, and if chemo is required, then chemo, and then radiation, and then hormone. Or where chemo is not required, then surgery followed by radiation and then hormone. And in patients who have had chemo earlier, a chemo, surgery, radiation, and hormone.
Okay. So, these are the like processes which you have explained so well to us.
Thank you.
So, I just want to ask about like how does breast cancer spread?
So, cancer spreading happens through two and sometimes three methods. One is from the breast through the lymphatic channels, it goes into lymph nodes, where axilla or supraclavicular sometimes or internal mammary, lymphatic channels. And the other is called the hematogenous spread, that is by the blood circulation into the lung, liver, brain, bone, all those things, or any other organ for that matter. So typically these two are there. In certain areas like ovarian cancer, in some other cancers, it's also by tumor shedding and by surface spread. So if I look at the hematogenous spread, like going to the liver and other areas, so this is more common with advanced cancer at presentation. Early stage cancer, the probability of spread is significantly less. And this is the thing which actually takes life or is more dangerous. So that is why, again, coming back to your first question, that how important is early detection, I think that is the key step. If we detect early, treat them systematically, then more than 85-90% people will get cured of cancer.
Thank you so much for telling us this also, because I believe early detection is literally important, and that is very clear after listening to your thoughts and your information. So I just want to ask one more thing, that there is always a fear about the hormone therapy. Why is it so?
Not, I won't say so much fear, but hormone therapy, as I said, is a very important tool for treatment in in breast cancer, and all those patients who are receptor positive must be treated by hormone therapy. The fear word probably, So it has first and foremost very limited side effects. It's not without side effects. Having said that, the probability of having those side effects is significantly less. Hardly 2% women have any significant side effect. So that compared to the advantage is huge, is very different. So I would say that hormone therapy is very safe, very effective in properly selected patients. In fact, now there's a reasonably good subset of people where we start with hormone therapy and not by chemotherapy. If you're a strong hormones positive tumor, then we better start with hormone therapy to shrink the tumor also. It works very well. So it is pretty safe.
That's nice if it's safe. That's the main part if it's safe.
Correct.
But there's one more very important thing which I personally also believe, that breast cancer or any cancer affects the patient emotionally also.
So I think this is a very, very important topic and not so well discussed often. And people don't express their emotions, their fear, and that also becomes a limiting factor. They don't reach out to appropriate support and help within the family, with friends, and with others. So I think this is a very important part of the discussion. See, emotionally getting stressed or getting worried, the fear of losing life, the fear of not being able to support your children or parents or whatever situation one is in, that anxiety adds to the whole situation and it has a negative effect on the body. So, personally, I feel it's always good to talk about your disease. It's very important to discuss your problems, discuss your challenges. There's so many people who have gone through the same treatment and have come out of it. So it gives you emotional support and gives that sense of well-being and strength that you too shall win. That is very important to believe. And for example, we have a very strong cancer support group where people emotionally support each other. We have a terrific psycho-oncologist or counselor, Hiba. She does her job very professionally and she spends a lot of time with patients to help them understand that this is a phase in life, this will go, and then you'll have a better life after this. But while you're going through it, while every side effects may sometimes get multiplied just because of this fear and because of this emotional stress. But if you're confident, if you are able to discuss freely, frankly, then that side effect will look smaller. Then you will be actually getting ready for your next round of treatment. But if every problem becomes magnified, then it becomes a big hindrance in treatment and also in communication. So I can only say that support is available, professional support is also available, but also friends and family. Unfortunately, there is no genuine counseling. Even we fail doing that and doing it for the friends and family, that what to say, what not to say, how to broach the discussion, because every time talking about only disease and only fear is not a good thing. There are also positive stories. Somehow people don't discuss the positive part. They only bring out the negative part all the time. And that instills fear. So I think the simpler way of fighting it out is by discussing, solving, and taking small steps to recovery.
Small
That
steps,
helps.
and also like thinking positive about it,
Yeah.
not being scared, not being like, because usually people think they might be like they will live or not, this life will be saved or not. So I also want to know, like, what are the precautions if somebody has cancer? They might be feel like having a lot of issues. Like, obviously there are many issues added to it, many things are added, but what precautions one should take?
So, as far as while on treatment, I will suggest that follow the advice of your doctors. Okay, that is very important. In a general way, I would say, as we were discussing, that you have to remain positively intended. Solve your problem. Not saying ki positive means ki just keep smiling. That doesn't help. Positive means that going with the flow and trying to read or do things which give you positive thoughts rather than going into a negative spiral. All your friends who only talk about negative stories, I generally tell my patients, don't pick up their phones. Tell them, भैया अपनी story अपने पास रखो. I know what I am doing and what I have to do. So that is one part. But while on treatment, hydration, energy, regular eating, don't fast, regular exercise, yoga, all these add to the value. I have come to believe that it also adds to improving outcomes in terms of survival. Because I've realized that those who are able to motivate themselves doing things appropriately, they do much better.
Can you also tell me about the medication, like medicines? How long is it? How long time span one should take the medicines and all of that?
So chemo and all this treatment generally gets over in 6 months. In
Okay.
certain situations, in 1 year. So you're done with that. But if the hormone therapy is there, that treatment may continue for 5 or 10 years depending on your stage at presentation. Early stages, 5 years. Locally advanced stages, 10 years of treatment of hormone therapy. That works.
And there's also one thing about the weight gain or the weight loss. Can you please just tell me more about that also?
So, weight, or as we were talking about cancer prevention, so there I want to take a minute to explain that lifestyle has huge impact on cancer incidence. So, if you look at it, not just cancer, cancer, cardiac, strokes, and lot of other diseases, even I believe that osteoarthritis, they're all linked with lifestyle, where the key factors are poor eating habits, not taking fruits and vegetables, and junk food has become the central attraction for people. Then lack of exercise, and this leads to weight gain and obesity, and that has a huge impact on these diseases. Also, tobacco, alcohol, we know are important for causative factors cancer. But I have come to believe that even screen time is the new addiction, and that is causing a lot of problems, lot of diseases, not just poor social networking because people hardly talk; they only message it to each other and on spend a lot of time and have thousands of friends, meaningless friends, and not one or two good friends. So that also leads to poor emotional support. It also leads to depression and other problems. So I would say that this should be brought in as an important etiological factor. Sooner or later, it will happen data wise, but by clinical experience, I would say that this is an important factor. In fact, now it has come for the first time in the guidelines that screen time should be limited. It was never there earlier, but even our Indian guidelines for nutrition and healthy lifestyle, they have brought in screen time as an important factor.
Thank you so much for sharing this screen time issue because usually nobody is aware of this, and this is one of the major thing I also personally believe. And being around positive people is also a plus factor if you are suffering from something like this. So, today we have learned so much about breast cancer, early detections, treatment, precautions, and a lot more. Thank you so much, doctor, for simplifying this topic to us in a very, very easy way. And it is so important, like you have explained it so well. I think so, it's very easy for everybody to understand it. So just remember, if you have any signs, early detection is really very important. If you or somebody you know faces any issues or changes in their body, please do consult a doctor. Don't forget to subscribe and share this episode with your friends and family. Awareness starts with you.